Ridwan. I'm one of the surgeons with the Signature Group. We have Dr. Ahmed here as well, our medical director and senior surgeon. We're going to be covering some questions relating to forehead reduction surgery, a procedure that's becoming more topical, and many patients are inquiring about it and having the procedure done. So thanks, Dr. Ahmed. Who would be the typical patient that would require a forehead reduction?
So the typical patient that requires forehead reduction, speaking female, if the forehead height is more than 7 centimeters, because aesthetically speaking, the forehead should be anywhere between 5 and 7 centimeters in the female. If you want to define the distance, it's the distance from the point between the eyebrows till the start of your hairline. So if this distance in females more than 7 centimeters, and in males more than like 8 or 9 centimeters, that means that you are a very good candidate for a forehead reduction.
What would be the benefit of it? Is it aesthetically a better procedure to do? Is it something, do you think, older patients or younger patients should do, or just someone who feels conscious of having a very wide...
I think it's not limited to the age by any means. I believe so far maybe in like 14, 15 months. Now I think I did around 40 of them. Looking at it as a very rare surgery, this is a very, very good number actually. The other thing that makes Signature Clinic really different and really unique doing this procedure is that we do it very safely under local anesthetic while the patient is awake, so there's no need for this long list of preparations and everything, and the very long period of recovery after the surgery. Yeah, candidates, they can vary age-wise, gender-wise, males and females. We have done both. And also indication-wise, if you feel that if it's not an impression, it's not a feeling, it's numbers. So if you take the distance, find more than the values that we have just mentioned, yeah, you are a good candidate.
So obviously, a patient would reach out to our consulting doctors. They would be assessed first to see if they're good candidates, and if they qualify, in other words, they have a wide enough or long enough forehead, and then they'd be booked in for surgery. The surgeon would see them on the day, of course, measure out where the procedure, where the incision lines would be.
That's right.
Do you want to tell us a little bit about the different variations in surgical scar placement? I know many people would be concerned about showing of the scars. How far do they go? We know that in some cases it'll just be across the forehead. In some cases it'll go laterally on either side of the forehead.
Yeah, so the types of the forehead reductions that we are performing here in the clinic, there are 3 designs actually. So there's one of them that is just a line that goes along the hairline. This line should be anywhere between 10 to 14 centimeters. It's according, of course, to the size of the head. And just from the angle to the angle of the hairline. And I prefer that when the amount of advancement that we are wishing for is like around 2.5 centimeters. So there's no need to do extra cuts or anything. It's shorter in time, the surgery is. You can get everything done maybe in 1 hour. If we wish to advance the hairline much more than, let's speak, in 3-4 centimeters, that means that the wound should be bigger. And it should extend along the frontal hairline, and we should extend it also back into the hairs for like 9 or 10 centimeters on each side, so it looks like a U-shape. And that gives us the advantage of, that it will be much easier to advance, the scalp and get much more advancement on the hairline. So that will be maybe 3-4 centimeters. If you go check the clinic or my own page on Instagram, you find different cases, several cases of our patients who are happy to share the results, and you may find also the amount of advancement that was achieved. The third design is when someone is having receding hairline, naturally on the front and on the sides, so it will be all along the hairline, and also same rules apply. The advancement will be around 2 to 3 centimeters. What makes us really different regarding it, away even from doing it under local anesthetic safely, is that there are no stitch marks, because all the sutures, they are dissolving, and at the same time they are completely 100% hidden under the skin. So everything dissolves on its own. You'll never be left with ugly stitch marks or anything. It will be like a very thin fine line that runs across the hairline. I intentionally make it like really random and regular ups and downs. So becomes really hard for the human eye to be able to recognize that you had a surgery done.
I think that's very convenient for patients. And just for patients' benefit, do you want to explain what is the nature of the tissue that it can be advanced by that much? I mean, 2.5 centimeters, it doesn't sound like a lot, but it's quite significant if you had to measure, the distance on your forehead. How is it that you can actually stretch the tissue? So maybe our patients can, they'll probably want to know how that happens.
This is actually a brilliant question on two aspects. So, I find it very convenient to mention here that the scalp has five layers, and the crazy thing about it that each letter of scalp just translates to one of those layers. So it's skin and connective tissue and areolar tissue, loose areolar tissue. So skin, connective tissue. What was it? Yeah.
Aponeurosis.
Yeah, aponeurotic tissue, and loose areolar tissue, and the pericranium. So the plane that we do the separation in is the fourth plane, actually. So it is the loose areolar tissue. So you have 3 layers above and the pericranium below. So the pericranium is a very, very thin membrane that covers the skull itself. So those 3 layers, they are really strong, really tight, and the only way to be able to stretch them and to advance them is to cut incisions at them, and we call that scoring. So scoring is a very well-known trick in plastic surgery. Generally speaking, we can extend many, many tissues using them, and used in several surgeries. And forehead reduction is one of the surgeries that scoring shows advantages, actually, in that, because looking at the third layer, the deepest third layer in this piece of tissue that we are moving, the aponeurosis, so it's really strong and it's an unelastic layer, so it will never move unless you score it. And I score it in a technique that makes sure that the circulation is still running all over the place, just to make sure that there are no complications or anything, or any circulation compromise.
During the surgery, what can the patient expect to feel? Is it a very painful procedure? Is there lots of bleeding?
My favorite punchline is that I tell the patients that you feel a needle prick, then you feel that we are giving you a very deep head massage, because we are really 1 or 2 layers from your brain. It shouldn't be scary. Okay, but you will feel just a few needle pricks at the start of the procedure, and otherwise you feel just pushing, pulling, tugging, and that's it. So it shouldn't be that painful. What should the patient expect after surgery? So surgery, actually, we are not meaning to do that, but gives you a little bit of a brow lift. This is by nature. The other thing is that you may find some swelling, some bruising in the forehead, maybe around the eyes. Definitely you will experience some numbness on the front of the head, and that may extend a little bit back if we have to make a little bit of a bigger wound, because by nature we have to cut few nerves. It takes quite a long time for those nerves to heal, if they will be able to heal. This time may extend anywhere between 6 months to 2 years. The other thing is that away from swelling, bruising, yes, so some patients, maybe 10% of the patients, maybe even less, they may experience a temporary hair thinning. So, and that doesn't happen all over the scalp, just happens on the front of the scalp, maybe the front 1 or 2 centimeters, but don't worry about it, because there's stress happening in this area. The skin is under tension and everything, and hair follicles, they are really very, very sensitive structures. So when they are put under such tension, the hairs start to fall, for now, just temporarily, and within 3 months everything grows back again as if nothing happened. So it is not a permanent thing, but as a patient, of course, it is your right to know that this may happen.
So far a good troop of happy patients that have had the procedure, and confidence improved.
It's a huge thing. You can now put your hair differently. You can go to meetings and gatherings, and going to work, to the uni, with much more confidence. You should listen to the patients' reactions on table, once we finish, and we hand them a mirror just to take a look how it looks like. 100% of them were excited. 100% of them were happy, which is a great thing.
Yeah. So a wonderful procedure to add to the armamentarium of Signature Clinics.
Sure,
offering.
yes. Sure, I believe so. Forehead reduction is, I believe we are now a center of excellence of this surgery. There are nearly no competitors. I don't know any other clinic that does it under local anesthetic that safely. Yeah, and just if you're having this problem, please don't think twice, because guess what? I've met few patients and they said, we never know that there's such procedure.
Yeah. So skilled surgeon,
there is
day surgery, convenient, cost effective, and you know you're getting a professional, properly clinically qualified staff looking after you
Sure,
at
yes.
Signature Clinic.
Sure.
Well done.
Thank you very much.
Thank you.
Thank you for your time.